Hello, I'm Christopher Inglefield from London Bridge Plastic Surgery. I'm going to talk a bit about the recently published Keogh Report into Cosmetic Surgery Standards. Really, what is this all about? This is all about trying to improve patient safety in the cosmetic surgery industry, both for surgical procedures and non-surgical procedures. The Keogh Report is an extensive document which made several recommendations, and here at London Bridge Plastic Surgery we fully support this drive to improve standards. So let's look at the recommendations made by Sir Bruce Keogh in this report. The first recommendation is to make dermal fillers prescription-only medicines. Although I support fully the intention, which is to try and improve the safety of dermal filler treatments in the UK, I think that this recommendation is illogical. Dermal fillers, by their very definition, are inert products injected into the skin and have no local or systemic effect on the patient. This would be the same as making a knee implant a prescription-only medicine, and it makes absolutely no sense. We have in the UK a law which allows anyone to inject another person with a medical product. This law dates back to the 1950s when mass immunization was necessary in schools and throughout the country. And what needs to happen now is to amend that law to ensure that anyone injecting another person is a fully qualified medical professional. This will cut out all of the non-medical individuals using dermal fillers or toxins to treat other people. They should not be allowed to do. The second recommendation in this report concerns proper training and qualifications for individuals providing cosmetic surgery or cosmetic treatments. That includes dermal fillers and toxins. And here at LBPS we have been at the forefront of driving the industry as well as our profession to provide better training, better standardization of training, and ensuring that only fully qualified individuals are allowed to carry out specific treatments or procedures. The third recommendation deals with providing adequate information to the patients and their GPs on implants used on the individual. And we fully support this. In fact, at LBPS for the last 15 years, we have provided our patients with a personal implant record to ensure that they have that wherever they go. They have a record of any implant used during any surgery. And we ensure that we also have a register of all the implants that we use during surgery. The fourth recommendation is something which is very, very dear to my heart, since it concerns the National Breast Implant Registry. In the UK, we had one of the first breast implant registries, which was maintained at East Grinstead Hospital. This registry was closed by the Department of Health, and we think that one of the most important steps that could be achieved by this report is to re-establish a national breast implant registry, and we fully support this move. The fifth aspect of this report deals with providing patients with full information about their procedure or treatment and allowing them adequate time to consider the implications of their procedure or treatment. Well, this is what the GMC or the GDC or the NMC bodies call full informed consent. It is essential that patients are provided with all the information that they need to make a fully informed decision about any procedure or treatment. And here at LBPS, we strive very hard to ensure that patients get both verbal and written information to really emphasize the important decision that they are going to make about having a procedure or treatment. So the sixth area covered by the Keogh Report concerns advertising standards in cosmetic surgery. I personally feel that this should not be an issue, since in the UK we are very fortunate to have the Advertising Standards Authority, who is guarded with policing advertising standards in the UK. This should be, the Advertising Standards Authority therefore should be given the guidance to ensure that only appropriate advertising is provided to consumers for all medical treatments, not just cosmetic surgery. This applies to everything that is carried out for medical. Last but not least, one of the key areas covered in the report concerns the issue of insurance for patients. Much like the ABTA insurance that you use for your travel when you're going on holiday, the issue is are patients adequately covered when they have either treatments or surgical procedures, whether it's with a sole provider or in a clinic setting? Well, by law, all doctors and nurse providers have to have medical protection insurance, which provides a cover for patients in the event things go wrong. I think that this needs to be improved so that whether it's a sole provider or a clinic, the provider has an insurance which not covers their legal costs, but also covers compensation for patients when things do go wrong. Because in medicine, even with the best care and the best intentions, things can go wrong. And patients do deserve some form of compensation when these things happen. So in my view, we should have an insurance cover that either was a sole provider who holds an insurance cover to provide, whether it's product liability or liability for in the event of treatments going wrong or surgery going wrong, but also the clinic must hold an insurance policy, because especially with where we have doctors coming in from overseas to provide specialist care, or whether it's because the UK is a lucrative market for cosmetic surgery, but the clinic then holds the insurance cover so that even if the doctor never returns to the UK, the patients who he or she has treated has insurance cover in the event that something goes wrong. So this whole area needs to be completely looked at in a different light, rather than just the box standard approach, which is providing insurance to protect it. So I hope this kind of video blog has been helpful for you to give some insights into the issues involved in improving standards for cosmetic surgery and treatments in the UK. And I certainly hope that we will see some positive moves on this in the future, and look forward to working with industry and with our professional bodies to drive these changes forward.